Hello and welcome to Natural Healing with Oriental Medicine. I'm Grant Boxleitner. Our topic is treating colds and flu, and right now I'd like to send it out to the president of East West College of Natural Medicine, Russell Badiata.
Thank you, Grant. I'm Russ Badiata, campus president at East West College of Natural Medicine. Each year, as many as 20% of Americans get colds and flu and miss a staggering 70 million workdays as a result. That can become costly and unproductive. It's estimated that healthcare costs for colds and flu can reach $12 billion annually. Who can afford that? On today's program, we'll discuss the common cold and flus and how effectively they can be treated with Oriental medicine.
Thank you for that. And now let's head back out to the college to see a demo of the treatment up close with Dr. Brandon Fuller.
Thank you, Grant. Hi, I'm Dr. Brandon Fuller from East West College of Natural Medicine, and with me today is a student here at the college, Eva, and we'll be discussing and showing you how we treat the common cold and flu. Now, the common cold and flu, we get it every year, right? There's always one of those seasons, everybody says, hey, this cold season's coming up, or hey, I've got that nasty crud that's going around. We know this. We specifically have treatments for this in Chinese medicine and Oriental medicine. All right, we call it wind invading the body. And it sounds a little strange, but think about it as if you're at a football game, right? And you're sitting at the football game and a draft comes through and you go, ooh, I got a little chill. And you get up and you're walking away from the game after the game, you go, oh, wow, now I've got a little bit of a sore throat. What's going on? And then next thing you know, you wake up the next day and you've got the fever and you're shivering and the sore throat's a lot worse and you've got a headache and you just don't feel well. Acupuncture can treat that. We have many points that actually treats that. When you come in to see us, it won't be any different than when you go in to see your primary care physician or your general practitioner, right? We'll listen to your lungs, we'll take your temperature, we'll take your blood pressure. And with that, we'll ask you more questions. How are your bowel movements? How's your urination? It'll sound a little funny, but all of this gives us data and how to customize a treatment specifically for you. Right? So Eva, if you don't mind, I'm just going to listen to your lungs. We'll start there. And I'll just have you take a deep breath in for me. All right, and another deep breath in. Good. And another one. Good. And one more. Great. And so her lungs actually sound clear. I don't hear any crackling or what we'd call rails in there, which might indicate that the pathogen has started to move into her lungs or is now in her lungs, right? So next what we'd do is we'd take a little thermometer and we'll just scan it across her forehead, right? And this will tell us exactly what her temperature is. Your temperature is normal, you don't have a fever. And then we might use something like a blood pressure cuff. Everybody's been to the doctor. They all know about getting their blood pressure taken. What most people don't know is that when you have a cold or flu, your blood pressure might rise a little bit, right? This cold and this flu that you might have causes inflammation in the body, right? And we've spoken about inflammation before. Inflammation in the body can cause the body to go into this little bit of tension, a little bit of tensive state, which causes your blood pressure to rise slightly, right? So Eva, what I'm going to have you do now is just lay down and we're going to show you some acupuncture techniques that we use to help treat. Just head here, legs here. Great, thank you. Are you comfortable?
I am.
Good. And so we'll use a couple of acupuncture points that are quite common for us. Some that we do use are on the hands, right? And what we have in Chinese medicine or Oriental medicine is called the lung channel, right? And the lungs end up being the first thing that are infected. When we get sick, we know we get a fever, we get runny nose, things like that. And then if it's not taken care of, it can go deeper into our body. That's just normal, right? We can have bronchitis, pneumonia, things can get a lot more serious. So with this acupuncture techniques, we might just use a couple of common points that help get rid of this inflammation and help deal with the stress the body is under, right? So what we're going to do, Eva, is we're just going to put a couple of points in to help you with fighting off any infection that you might be coming in contact with, okay? All right. And we'll come over to this side here. Some other points that we might use might be actually on the thumb. If you come into us with a severe sore throat, something that we've found that works very well is actually what's called bleeding a Jingwell point. So what we'll do is we'll take a small needle and we'll cause a little prick right around your thumbnail. That will help let out some blood in what we call heat, right? And we all know fever, heat, things like that. So this will help reduce that heat, reduce that inflammation, and it actually takes away a sore throat just like that. So how do these needles feel for you, Eva?
Not painless.
That's great. Good. Other things that we can do might be cupping, moxibustion, depending on what kind of wind cold it is in Oriental medicine, right? So if it's a cold draft, right, we have cold coming in. It's about winter time in Florida, so we might catch a cold and what we'd call a wind cold, right? And so we'd use something that heats the body up, what helps heat the body up and warm the body. So we might not take the heat out in a treatment like that. If it's middle of the summertime and a wind gust blows, that might be called a wind heat attack, right? And so we'd want to help take some of that heat out. Now with all of this, you'll be given an herbal formula specifically designed for you. Right, and that will help to reduce any heat, any inflammation, get rid of bacteria. Right, some of our herbs are actually antibacterial, antifungal, antiviral, and so using these herbs, we can help expel these problems from your body. Right. Also, we can use injections. So today, Eva, I'm also going to give you a little bit of an injection, and with that injection, it's all natural. We have homeopathic injections, so it won't interfere with any medications that you're on. And it'll help your body fight and deal with whatever infection is going on right now, okay? All right. And so what we're gonna do is grab some gloves. And the needles that are used with these injections are so fine, so tiny, they're almost like an acupuncture needle. Most patients who get an injection from us, when we say, okay, that's it, you're all done, they go, wait, aren't you going to do the injection? And we'll go, we already did it, right? So that's our goal for every single patient that walks through the door, to make sure that there's no pain associated with these treatments. Right? We want to help you get better. We don't want to cause you more pain. Insert the needle, put a little solution in, and then you're set. And how was that?
I literally felt nothing except for the pressure of your finger.
Perfect. That's what we like to hear. All right. And so that's going to conclude for today. And what I'm going to do is cut back to you, Grant. So thank you.
Okay, don't go away. When we come back, we'll have questions with Dr. Fuller and Dr. Stephen Wrench when we come back.
Opioids are now a public health emergency in Florida. So what have you been prescribed for your pain? East West College of Natural Medicine understands the age-old Eastern philosophy of natural healing using acupuncture, herbs, and massage. Here, we combine Eastern and Western healing that results in a unified solution, individually tailored for you.
Massage is a powerful tool. It can alleviate pain, heal injury, and support well-being. East West College of Natural Medicine can prepare you for a career as a massage therapist. Our curriculum combines Western and Eastern massage therapy approaches, and the program includes an internship and job placement assistance. Launch a career you can feel good about. Start at ewcollege.edu. East West College of Natural Medicine, nurturing careers in the healing arts.
Welcome back. We're talking about treating colds and flu, and Dr. Wrench and Dr. Fuller, what is the difference? We'll start with you, Dr. Wrench. What's the difference between catching a cold and catching the flu?
Well, a cold, Grant, generally involves the upper respiratory tract. So we're talking really about like your nose, sinuses, and so on. Could be a scratchy throat, could be runny nose, could be a lot of sneezing.
All these nagging symptoms.
Yeah, but the flu, a little bit more severe. It comes on a little bit more suddenly, whereas the cold kind of creeps up on us over a few days. The flu comes on rather suddenly. It involves the lower respiratory tract, specifically the lung. So we're going to have a cough, we're going to have body aches, we're going to have fatigue, we may have a headache, and so on.
Even some fever?
Oh yeah, definitely fever and chills, and more pronounced than, say, with a cold.
Right. All right, so Dr. Fuller, what causes colds and the flu?
Well, Grant, colds are generally caused by bacterial infections, fungal infections, viruses.
Things that you just get out and about and catch from the air.
You know, we'll get into this a little later, but there's many different ways you can catch it. And flus are specifically caused by viruses, influenza A or influenza B to be exact.
That could be anywhere, on surfaces, in the air.
Right.
Yes, this virus is just out and about. Okay, so I understand pneumonia is much more severe than both of these conditions. Can you talk about that for a moment?
Well, pneumonia actually is very severe, and it can be life-threatening at times. One of the main causes that we know of is that infection from bacteria, fungal, and viruses. And what happens is the virus starts to spread its way down into the lungs. And as that happens, it starts to infect the alveoli, which are the little air sacs in our lungs.
Does it affect your ability to breathe?
Yeah, it can.
Definitely.
It can definitely diminish your ability to breathe, and it makes it harder. It makes it hard to get up and
Difficult even to speak, or a very, very pronounced cough that's painful.
Like shallow breathing in some cases?
right, exactly. yes.
So as this fluid collects, does it just have to run its course, or does...
Generally, what we say is we want patients to get a medical checkup, right? Whether it be through us as an acupuncturist or at an MD's office, and then we can run them to the MD's office. They can get a script for antibiotics because it tends to be that serious.
You know, if we may, we were talking about the air sacs in the lungs, and what happens is there becomes, they get filled with moisture, and then this can become very purulent. So what happens, and the reason that's so critical, that you have a lot of air sacs in your lungs. In fact, the surface area, if you could take those out of a human lung and you could iron them flat, they'd cover a tennis court. Wow. So there's that much surface area. So when they're affected, this is a very big deal. So
yeah, you certainly don't want that moisture in there. So how many people are affected by colds in the U.S. each year? Well,
at the outset, you saw our President Russ allude to 20%. So just to kind of simplify that, during our lifetimes, the average person in America, somebody comes up with these stats too. I don't know how to find this. I actually like these things. Yeah. It's kind of interesting, but it's that little category of did you know? Well, did you know this? In our lifetimes, roughly speaking, we'll get 200 colds. So we'll get 2 to 3 per year. Now, if we're on the hardy side, we won't catch so many. But the average person, 2 to 3 colds a year, and if we're a child, we're talking about maybe 5 to 6 colds a
And
year.
this depends on exposure. It depends, but even if you're healthy and take care of yourself and try to avoid and and stay in certain areas, you can still be inflicted by this.
You can. It depends. Certainly, there's a lot that goes into the strength of the constitution. Where are you? Where is your immune system, and are you compromised, and so on. But look, we say kids 5 to 6 times a year because we're kids with other kids all day, and they're touching everything, and they're not washing their hands all the time, and so it's rampant.
Well, it sounds like this keeps doctors very busy. So, what are some of the common things that we can do to prevent the colds, flu, and pneumonia?
Some of the common things that we can do to prevent is just simply a healthy lifestyle, right? So we think about eating more healthily, fruits and vegetables, getting exercise, don't smoke, and
Plenty
make
of rest,
sure
the
you're
right diet,
getting plenty of rest. One of the things that we like to say, at least in the clinic, is when we're treating a patient, a lot of times they come in, they want to go to the gym. We want them to take it easy to get started. We don't want them overexerting themselves. Right.
And so you shouldn't always think that exercise, is the cure-all, be-all for these conditions.
We've talked before about what are the pillars to good health, and the old school was rest, exercise, and diet. What does that mean? But if we say sufficient rest, regular exercise, it doesn't have to be the Ironman triathlon,
So
but
more
regular exercise.
detailed,
Yeah,
when
so
you're
your body
talking
gets
about
acclimated. You're physically fit. Rest, appropriate, the right kind of exercise,
Yep.
but regular exercise, plenty of rest. Proper or sensible nutrition, and that's another show for another day, right? And then what we call preventative medicine. But one of the things that we say all the time, and because we're a medical college, wash your hands. Wash your.
And
in
we
the old
see
days,
signs up everywhere. Did you wash your hands?
Well,
You have-
remember, the high fives and the shaking hands, and now people fist bump. It's gotten so we pass each other in the hall. We do one of these. We
Ooh,
go
almost an elbow, or like
pop the head up.
yeah.
We just hey,
just a nod or something.
But if you think about it, just your cell phone, just the average cell phone has 25,000 different kinds of bacteria per square inch. And here's the weird fact. That's 10 times what you would find on the toilet seat. And I've researched this.
I know.
In a public restroom, and we don't need to go any deeper into that, I don't
No,
think.
definitely
But think
not.
about that.
But that's
disgusting. That's your
incredible.
cell phone. Think about computer keyboard, doorknobs.
Everything else in your
everything.
life. Yeah, it's amazing. So does Oriental medicine share the same viewpoints of colds and flu as, say, Western medicine?
Yes and no. What we have in Oriental medicine is two different subjects, right, or two different categories for the colds and flus. We have what's called a wind cold and a wind heat. Now, if we think about it in a sensible fashion, we don't want to sound too weird when we go, the wind's bringing all this pathogens into you. But if you think about it like, Grant, if you had the flu and you sneezed right now, your droplets from your sneeze can travel up to 3 feet before they start to drop.
At 120 miles an hour.
Exactly.
Whoa, so you guys are
crazy.
in the zone here.
Yeah, we're right in that zone.
Bring it. We got the data.
So, it's that sort of thought process.
Right.
We just call it
Yeah.
something different, right? So it's not that we're trying to be mystical, it's just how we call it, right? And when we talk about like wind cold, we might say, you're going to have more chills than you are fever, or more of like a little bit of a scratchy throat. Whereas a wind heat will be more sore throat, higher fever, a red phlegm that you might be coughing.
Yellow phlegm.
Yellow phlegm.
Yeah, the
Sorry,
yellow
not
phlegm.
red phlegm.
If you see red phlegm, call 911. Okay, I'm just saying.
Yeah, some blood in your phlegm. Well, so can regular acupuncture help in the prevention of cold and flu?
Yeah, it can. You remember we talked in previous shows about the ability of acupuncture to tonify, we use that word a lot, to boost,
Right.
to strengthen. And there are points on the body, back to the old computer analogy, we're a computer, and our acupoints are just triggers or like keys on a computer keyboard. We can actually, and through proper nutrition and plenty of rest and all these other adjunctive therapies or lifestyle changes, we can boost the immune system. And we don't really do it, but we communicate with the body and get the body to do it. The body knows how to strengthen itself. It just needs a little help from the owner. And so if we boost the immune system, we take herbs as a preventative also. You know, so often we're wired as Americans to get sick, go to the doctor.
Right.
But in our medicine, it's go to the doctor, get sick, go to the doctor, get medicine. In our way of thinking, it's go to the doctor, get medicine, don't get sick. So the cart precedes the horse, so to speak. Just a little bit different. So there's a lot of things we can do.
So acupuncture and herbal therapy
Absolutely.
can certainly help if you're dealing with this sort of thing. So when we come back, we're going to touch on more, but is there anything else that we need to hit home when it comes to colds and flu before we continue to talk about treatments and so forth?
Well, you know what, you touched on it, so why don't we talk about wind and so on. There are actually, and this is going back to kind of what we call a Taoist traditional viewpoint of the body, but in their parlance, in the ancient times when this medicine came into being 5,000 years ago, they looked at things in the human body and they compared them with things in nature. So when we are attacked by wind, one of the places that wind really affects the body, so to your analogy, at the football game, and I took a windbreaker and it was the coldest day of the year. I should have brought a heavy coat and I didn't. So the wind is most dangerous to us up top here. And so our neck, that's why if you sleep under a fan or in an event, an air conditioning vent blowing on your neck, a lot of times you wake up in the morning, your neck's stiff. So there are certain points that are triggers that are very susceptible to wind and so on. So that's why we say, if you're going to cover anything, wear a scarf, pull your collar up, put a hoodie up, but protect your head. Otherwise, the sinuses, the allergens that float on the wind, and all these things. So the Chinese analogy is that the wind, and you can see it, affects the top of the tree first. And this would be the top of the tree, the neck, the head, the sinus, the ears, the sore throat, all these things.
Great information, and we're going to have much more when we come back.
Opioids are now a public health emergency in Florida. So what have you been prescribed for your pain? East West College of Natural Medicine understands the age-old Eastern philosophy of natural healing using acupuncture, herbs, and massage. Here, we combine Eastern and Western healing that results in a unified solution, individually tailored for you.
Massage is a powerful tool. It can alleviate pain, heal injury, and support well-being. East West College of Natural Medicine can prepare you for a career as a massage therapist. Our curriculum combines Western and Eastern massage therapy approaches, and the program includes an internship and job placement assistance. Launch a career you can feel good about. Start at ewcollege.edu. East West College of Natural Medicine, nurturing careers in the healing arts.
Welcome back. We're discussing treating colds and flu. And Dr. Fuller, I want to ask you, what else may you recommend to a patient who wants to take these preventative measures when it comes to these conditions?
Well, Grant, certainly acupuncture is very helpful, and let me start there with the research has been done to show that specific points, like one that we commonly use called stomach 36, has boosted the immune system by 3 times its normal value.
Now, does that mean where you're going to put the needle?
Yeah, right, that's correct.
Okay.
Yeah, where we would put the needle, and so doing that acupuncture point or needling that acupuncture point will boost your immune system by 3 times its normal level. Yeah. And then what we can see is that immune system will start to continue to stay that high after a certain amount of treatments. In conjunction with herbal therapies, we have one called jade windscreen, which is used to boost the immune system. So we can use both herbs and acupuncture in conjunction, along with homeopathics, actually.
Now, does someone come in for like usually the cold can linger for a few days. Would this be something where if someone was getting some acupuncture treatment to treat a cold, they would come in a couple times a week?
Yeah, normally a couple times a week. If it's more severe, first of all, how bad do you feel? Do you feel like coming in here 3 times a week? If we feel miserable, what do we want to do? We want to lay in bed and medicate and sleep.
Yeah.
But you're talking about a span of maybe 1 to 2 weeks. We would normally see them just maybe a couple times a week for 2 weeks.
And that, Dr. Wrench, kind of comes into our next question. Once a person has already caught a cold, how do you proceed to treat them using this acupuncture like you mentioned, a few days a week. But is it more than just the stomach and this wind?
Yeah.
You would do a whole mock-up?
Well, remember that we've talked about this a lot in prior shows, that there's this 400 plus acupuncture points on the body. And they all do more than one thing. There may be one or two that do only one specific thing, but most of the time, and this is the miraculous part of this medicine, is it has several functions. And the weird part is when you trigger a certain point, the body knows, because it understands balance and it understands what's wrong with itself. So when we trigger a certain thing, the body goes, so you want me to do this? So the hard work's been done for 5,000 years.
So it triggers a response.
Yes, but if, let's say, you have heat, we can actually have points that clear heat from the body. It will literally lower the heat level in the body. And it's a gradual thing, but it works. In the example of if you're more susceptible to cold, we have a certain approach that we would warm the body using moxibustion, which we'll touch on in a minute, which is an herb that warms the body, or we give herbs that warm the interior of the body to help expel the cold. So we really can tailor the treatment, and these are really old and very commonly used protocols that we can use. What are your symptoms? And we treat the root cause, but we also can alleviate the symptoms systematically.
So, and you just referred to it, but we've discussed cupping and moxibustion on previous shows. So would either one of these modalities be used in an instance of cold or flu, for instance?
Either one or both. Yeah. The only time I would say we don't use heat, remember that if you have a heat condition, I have a pretty good, substantial fever, I have a sore throat, I have yellowish phlegm, these are all heat signs in the body. I feel more feverish than I do chilly, although I could have both. We don't put heat always. We don't put gas on a fire. So in a heat scenario, we would want to stay away from the moxa, but we might go more to the cupping and so on. We also have a couple things we do. One of the things, and I'll mention it briefly, we can get rid of a sore throat. And we're not talking about a strep, although there are herbs for that. But a sore throat, and having kids around, my whole life, we had 5 kids, we had sore throats now and again, and in about a minute. Get rid of a sore throat. And it's just a little trick. It's very simple to do, but wow, doesn't that help? And so there's so many, these are, again, just buttons we push on that keyboard.
And we're almost out of time, but herbal therapies, Dr. Fuller, could they prove helpful?
Definitely. We do have some herbs that have been proven through research to be antiviral, antifungal, antibacterial. And so a lot of times when we have these colds or flus, and these herbal formulas for them, they have these herbs in there to help kill or help the body recreate a defense mechanism towards this to help a patient.
Great information. Where can people go to get more information if they want a treatment to learn more about the college and the clinic?
Well, we're East West College of Natural Medicine. We're on North Trail, and we're at 355-9080. Give us a call.
All right, excellent. Thanks for joining us. We'll see you next time.
Massage is a powerful tool. It can alleviate pain, heal injury, and support well-being. East West College of Natural Medicine can prepare you for a career as a massage therapist. Our curriculum combines Western and Eastern massage therapy approaches, and the program includes an internship and job placement assistance. Launch a career you can feel good about. Start at ewcollege.edu. East West College of Natural Medicine, nurturing careers in the healing arts.